You're listening to Life Unrehearsed with DelVecchio and Stephanie Erickson, tackling the topics that life throws in your way. Brought to you by Severia Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
Good afternoon. What a beautiful day today. You're listening to Life Unrehearsed, a show where we talk about all the things that life throws at you. Perhaps you're struggling with some parenting, having some work problems, or maybe having some difficulty providing support for an aging relative. We will talk about it here. I'm Stephanie Erickson, social worker and family caregiving expert, here with my co-host, DelVecchio, retirement, home search, and senior transition specialist. Hello, Matt.
Hello, Stephanie.
Gorgeous day today, again.
Yes, great. And we're right by the studios, right by the Jacques Cartier Bridge, and it's Grand Prix weekend, so it's very good. And I guess Lewis Hamilton just won, so congratulations to him.
Oh, good.
We had, I wasn't able to do any of the weekend festivities, a lot of family stuff going on, but the big thing around the home was we just got a brand new puppy, Great Dane. And that's almost an oxymoron.
Exactly. Oh my God. How old?
A 22-pounder, 11 weeks.
Oh my God.
So you see the bags under my eyes?
Yeah.
Well, it was first night last night at home. So a lot of crying, a lot of whining, a lot of peeing all over the house. And the whole works.
Well,
you've been going through the same thing, aren't you?
Well, not yet, but we did. I know you remember a few weeks ago we had Zoe Quinn Phillipson, who is a consultant for canine specialist, and she came to my house and talked to myself and my children. We had our little consult. And we're going to be getting a dog, and it looks like we will probably be getting a puppy. So I'm already anticipating sleepless nights once again. Yeah, but I'm excited. My kids are super pumped up about it, so that makes it more exciting for me because they're really looking forward to it.
The kids loved it, and but they they love it. We'll try to keep them engaged for as long as possible until mom and dad have to take care of it full time, right?
That's exactly right.
Oh man, well we have two excellent guests. We've got a great show for you today. Thank you for joining us on Life Unrehearsed. Stephanie, I was in Toronto this week on business for a few days, and at lunch we met with some colleagues. And it seems to be this topic just keeps coming up time and time again. It really is I would say, a national topic. Dining room tables across Canadian families, right across the country, and it's about what we'll call end-of-life choices. And I think the terminology, you might have heard of an acronym called MAID, standing for Medical Assistance in Dying. And that's why we're very, very pleased to have with us lawyer Sabrina Cammisano. Sabrina, welcome to the show.
Hi, thank you very much for having me.
Thank you so much, Sabrina, for being here.
Thank you for joining us. And you're going to try to help us navigate through what seems to be a little confusion, a lot of question marks. And Stephanie, you've done a lot of research in this as well. And maybe to tee it up, do you want to start with what Bill C-14 is?
I do. Before I get to that, though, Matt, I just want to throw it out there. If anyone wants to call in, we'd love to hear about what your opinion is on a person's right to choose death. You can give us a call at 514-790-0800 or text us at 514-800. So to answer your question, Matt, so Bill C-14, which we just learned from Sabrina before we went on air, it's just about federal law. So she's going to explain Quebec law as well. But we're going to break it down, and then Sabrina, you correct me if my research is wrong here. A couple points. 1, a doctor or nurse can directly administer a substance that causes death. 2, either a doctor or a nurse can give the substance, and then there's some eligibility criteria. You have to have a serious and incurable illness, disease, or disability, be in advanced state of irreversible decline in capability, you're enduring physical and psychological suffering, and that your natural death has become reasonably foreseeable. And we can break down those points as the show goes on, but that's just the federal position and the federal law, right? So explain what's going on. What's the difference with Quebec law?
Absolutely. So that's the federal aspect. As you said, it came into effect on June 17th, 2016. So it's still fairly new, only about a year now. And so there's the Quebec aspect of it. Quebec actually came up with its law before the federal law came into effect. So the Quebec law came into effect on December 10th, 2015.
Okay, so about 6 months before.
Yeah, exactly. And there are some differences. So as you were saying, the federal law states that the substance can be administered by a nurse or by a doctor. In Quebec, only a doctor is allowed to give the
Oh.
substance.
Interesting.
Okay.
Another big difference is that the federal law allows people to obtain the substance from their doctor and administer it to themselves. In Quebec, again, that's not allowed. Only a doctor is allowed to administer the substance.
Okay.
So, we're in Quebec, so it takes priority over federal.
It
right?
does. It
So-
does. So now in Quebec, we have to we have the provincial law and the federal law, and we have to try to marry both of them and apply it, which is quite difficult because they don't always say exactly the same things.
Surprise, surprise.
But I can't, I can imagine. I mean, and you're a lawyer. Could you imagine, being in the medical field and trying to decide that? One of the main questions we have is who decides? There's so much confusion as to different scenarios. But let's say there's mom or dad or an individual, but who actually can have the final say? Okay, yes, you are eligible.
The only person who can decide that they want to ask for medical aid in dying is the patient themselves. So a family member cannot ask for their mother, their father. Only the person, the patient themselves, can ask for medical aid in dying. And then once that request is made to the doctor has to follow criteria that's in the law. And so there has to be very specific conditions in order for the person to be able to receive it. So they have to be in end of life. They have to have a serious and incurable illness and be in an advanced state of irreversible decline in capacity. And finally, they have to be in constant and unbearable physical or psychological suffering, which is a very difficult point to...
Yeah, and this is what I want to get to. You're listening to Life Unrehearsed. Stephanie Erickson here with Matt DelVecchio. In studio, we have with us lawyer Sabrina Cammisano, and we're talking about assisted suicide, and we're talking specifically about Quebec law. You just touched on so many points that I'm already thinking of a million questions. I want to back up a bit. You talked about that only the patient can decide and ask for this. What if the patient is in a coma but had written in their will that in their mandate in case of incapacity, they had written that this is something they wanted to, but they're maybe in and out of competency and they can't make the decision. Does that apply?
As of right now, no. In March, the Minister of Health, Gaétan Barrette, actually said that he wants to open the discussion to see if we can broaden the conditions so that a person with dementia or a person that's incapacitated in another way could ask for medical aid in dying. But as of right now, you need to be competent at the moment that you ask for medical aid in dying. And another little point that I'd like to add is the federal law states that we must wait 10 days between the moment that the person asks for medical aid in dying and the moment that it's administered, which wasn't in the provincial law. So that's something that people in Quebec are having difficulty with.
Although that does, I have to say, it does make a bit of sense because you might be having a really bad day and start asking or talking about something, and then your circumstances change and you might change your mind, I guess.
Basically, a timeout for the kids, right? It's just a granted timeout. But I think for the bigger topic, and we laugh, and you almost have to laugh about it because it's such a serious topic, and we've seen families ourselves that are going through this. The advance consent, which is I really have an issue with this one where say and particularly with seniors, say Alzheimer's or dementia, from what I understand, they're not allowed to give advance consent. It's considered illegal, even though they might know in 4 or 5 or 6 years down the road, and they can't make that decision. If I understand.
They can't make that decision. They have to be, as I was saying, competent at the moment that they ask and competent at the moment that they receive the medical aid in dying. So the problem with these 10 days also is that sometimes the person's medical condition declines so much that unfortunately they're not capable 10 days later and they're not able to receive medical aid in dying.
Well, that's sad because it's something they wanted and then they're out of time. I have a lot of questions around the physical and psychological suffering because that seems very objective and subjective. I mean, I want to know, who decides that? Is it the patient? How does that work? But first, we're going to head over to the traffic desk.
This is Life Unrehearsed with Matt DelVecchio and Stephanie Erickson. Brought to you by Saveria Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
Welcome back. This is Life Rehearsed. I'm Matt DelVecchio with Stephanie Erickson, and we're very pleased to have lawyer Sabrina Cammisano with us. Sabrina, hot topics. Thank you very much for your input. We're just to repeat, we've opened up the lines, so please feel free to call us. We'd like to hear about your opinion on a person's right to choose death, so you can call us at 514-790-0800, or you can also text us at 514-800. And Stephanie, before we went out to traffic, you were talking about in the clause, it actually says physical and psychological suffering.
Right. Which I experience daily, by the way, so I'm not sure this applies.
Well, that's it. It's such a general term.
Yeah.
And Sabrina, I think for the medical fields and even from the legal field, it is very subjective. And I guess how is something like this measured?
Yeah, you're not the only ones that are a little bit confused about it, because doctors themselves are not quite sure how to measure it, and so the person themselves is the one that has to tell their doctor that they are in a physical or psychological state of suffering that's unbearable to them. It depends on each person. One person could be very tolerant and another not so much, but it's something that's evaluated by the person with their doctor and with all of the criteria in the law.
Yeah, because I guess it's the same thing as a palliative care social worker a long time ago. When I did that, we used to say, what is your pain today? And we'd say on a scale of 1 to 10. My friend Isabel, she just dislocated her elbow 6 weeks ago. And I remember when I was with her in the hospital, she was reporting, she's a pharmacist, so of course she's giving me a scale as well. But she was reporting on a scale of 1 to 10 where she was at. And at one point she was at an 11. Poor her. Was horrible. But so I guess that's kind of along those same lines. Now, just to kind of switch, and I don't mean to be morbid, but I certainly have curiosity, and probably you do too. So let's say I decide, okay, physical, psychological suffering, the doctor says, yes, we're going to do this. How and where does it occur? What actually happens?
So the law says that there's 3 different types of places where it can occur. It can occur in an institution, in a palliative care hospice, or at home. In the institution, institutions have to offer medical aid in dying. There's a special section for palliative care. Palliative care hospices. They don't have to give medical aid in dying. So you have to be told going in that it's not something that they have to offer, and make a decision before you choose to go there or not. And it's also possible to receive it at home. I believe so far only one person has received it at home, so most people receive it in the hospital.
I find that amazing, only one person, one of the things, because my assumption would have been most people for dignity would want to do it at home. In Quebec, I suppose if that does happen, a doctor has to go to the home to administer the medication.
Absolutely.
Let's say we have that scenario, whether it's at home or in institution, and you have a very close friend or family relative that are just completely opposed, saying, look, this isn't right, there's something wrong, I know they don't want to happen, and they charge it out and they want to oppose this. Do they have any say at all?
As I was saying before, the only person who can consent is the patient themselves. So it can have an effect on the person receiving it psychologically. Maybe it'll make them change their mind or reconsider, but legally, no, it doesn't have an impact. Family, friends, no, the decision is really up to the patient themselves.
You're listening to Life Unrehearsed. I'm Stephanie Erickson here with Matt DelVecchio. In studio, we have with us lawyer Sabrina Cammisano, and we're talking about assisted death. I'm just curious, what have been the responses from doctors? Because here in Quebec, it's only doctors that can do it. To me, this sounds like a real ethical situation they may be in, because whatever their code of ethics is, it's to do anything to save a person, and now here they're being asked to actually help this person die. So has there been a lot of discussions around physicians, and are some choosing not to, and what happens in those situations?
Definitely. Doctors do not have to give medical aid in dying. So there's a clause in the law that says that doctors do not have to give it, but if they receive a request from one of their patients, they have to advise the director of their institution, and they have to make they have to take measures to find another doctor that will give it, and in the meantime continue giving care to the person, of course.
Which makes sense. You're not being forced, and it would really be uncomfortable situations. We have a caller coming in, so we're going to open up the line to Alice in Montreal. And Alice, welcome to Life Unrehearsed.
Thank you very much. I enjoy your program very much.
Thanks,
Thank
Alice.
you.
And I just want to say that there is another choice besides assisted death, and which is to wait for natural death to occur, and that many doctors, or a number of them, will not perform this assisted death, but they argue that rather palliative care should be improved to ease suffering.
That's a good comment,
It is a good
Alice.
point. And Sabrina, we'd love your comment on that too. And we've touched upon it too. Natural death, if it now becomes a moral issue sometimes. Maybe a family could be a religious issue as well. And natural death might be the choice of the family. I suppose, though, with this law, you now do have a choice. And like Alice had mentioned, it's not all doctors that will do this. And just reiterating your point, right? It's really up to the medical field to decide if they want to go down that path.
Yeah, but the thing that I find really hard about that, and Alice is making a very good point, and maybe palliative care does need to get better, maybe it doesn't. I'm sure we can improve with anything, anywhere. But the point you made, Sabrina, is that palliative care institutions or those programs don't have to do it. So if I decide that, you know what, I'm going to do this, I'm going to go natural causes, I can manage, I go to palliative, and then 2 weeks into it, I'm in so much physical pain, I change my mind. Now I'm kind of stuck. Like, what am I supposed to do?
There's some palliative care hospices do offer that service, but as I was saying, they must tell you beforehand if they do or not. If you do change your mind and do want to receive it, you would have to be either relocated or go back home and ask for it.
Oof. And how many people have exercised their right here? Like, do we have a statistic of how many have chosen this?
Yes. So Health Canada just recently published some numbers. In Quebec, between December 10th, 2015 and June 9th, 2016, there was 167 people who received it. And in Canada, so then with the federal law, between December 10th, 2015, to include the portion of the time Quebec had the law in effect, to December 31st, 2016, it's 970 people.
970.
Wow.
It's amazing. So, proportionally, even more in Canada. And relatively speaking, we're talking about just over 1,000 people in a population, across Canada, over 36 million. The assumption here, these numbers are going to just rise and probably rise dramatically. I know at supper tables and lunches with colleagues and friends, you hear comments like, that's not for me. I don't want to be a vegetable. Pull the plug. You hear all these terminologies. I think it's one thing to say it when you're in your 40s and 50s until you actually have to make this crucial decision. And I think the psychology comes into play for a lot of that as well. And from your legal perspective, are you seeing anything where there's conflicts where they're still not sure? Will they go to get some legal advice as to what's best?
As to what's best for their situation?
Yes.
Not that I know of. I think it's a very personal decision. It's very difficult to ask someone else their opinion on this. And people, I think, generally know what they want. It's important to say that people can always change their mind at the last minute. So I just wanted to add, with the delay of the 10 days before you receive medical aid in dying, the federal law says that that's in place so that people can have time to change their mind. The other side of that coin is that sometimes people become incapacitated within those 10 days and cannot receive it anymore. But it's important for people to know that once the request is made, it's not locked in. There's always time to change your mind before receiving it. And many people have, I don't have the statistics here, but a lot of people have asked for it and within the 10 days either changed their mind or weren't able to receive it.
Yeah, and what I find so interesting about this, Matt, you just made a statement about some people say, oh, I'm a vegetable, pull the plug, which is a statement that people say. But that's totally different than this, because now you're saying maybe I'm in a coma, I was in an accident, my quality of life is not the same, something happened. But it's different to have to psychologically say, let's say I have cancer, I know I'm going to die, and now I'm in pain, and to make the decision to end your life in that way, to me, I don't know, maybe it is the same thing for a lot of people. To me, I see it as being is really different. I don't know, Sabrina, when you're working with people, I mean, are you working with clients directly on this topic? Because you seem very well versed in it. So as a lawyer, are you working directly with people making this decision and explaining the law to them, or what are you doing?
The reason I know so much about this is also because I'm part of the board of l'Institut de Planification des Soins. I'm inviting you to go see the website if you don't know about it. So what they do is what we do is we help people learn about the care that's available and what they can do to plan their care in the future. So we give conferences, and there's articles that we publish online. So we're giving out information to people, basically.
And where can people get a hold of you, Sabrina? Because we're almost out of time here. Where can people get a hold of you if they have questions?
People can call me at 514-744-8001. My extension is 224. And I'd be happy to hear from you.
Sabrina, thank you very much. Really interesting, and I'm sure this isn't going to be the first time we discuss this topic, Stephanie.
No, I'm sure
Really
not.
hot topic. Well, thank you, Sabrina. Now, coming up, we're going to be speaking with Andrea Borode, who will be talking to us about another hot topic, and I see a lot of pregnant women out there. Postpartum depression is going to be our subject, and we'll be inviting Andrew. So let's head out to the CJAD newsroom.
This is Life Unrehearsed with Matt DelVecchio and Stephanie Erickson. Brought to you by Vecchio Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
I'm a ghost of a girl that I want to be most. I'm the shadow of a girl that I used to know well. Dancing slowly in an empty room.
Welcome back to Life Unrehearsed. Thank you for joining us. If you're joining us at home, or maybe you're in your car coming back from Grand Prix.
Yeah.
I'm Matt DelVecchio. I specialize in retirement home search and senior transition support, and I'm here with Stephanie Erickson, social worker and family caregiving expert. And you can also catch us on Facebook Live.
Yeah.
Thank you for all your comments. Every week we get more and more, so we appreciate that.
Yeah, and we forgot to mention we ran out of time with our previous guest, Sabrina Cammisano, who's a lawyer. You can reach her website. She said it was victim.ca, I
That's
think.
right.
Yeah, and we have it also posted on our Life Unrehearsed Life Unrehearsed Facebook page.
There you
Hello,
go.
put the sentence together.
All right, now talk about pardon the pun in Grand Prix weekend, but shifting gears. You go with that one? No, that's
Come
kind of love to. The next topic is certainly a topic that I think Stephanie, many women and men are talking about.
Yeah, definitely. And I mean, I was very lucky to not experience it. We're going to be talking about postpartum depression, and I wouldn't say I just experienced a depression, but I know a lot of women who actually have, and I would say maybe a borderline depression, or at least some guilt, shame about thoughts that they were having, maybe never leading into a depression. I'm very happy that we're talking about this today. We have in studio with us Andrea Borode, and she's not an expert. She's here to tell her personal story, which I have to say, I think it's very courageous for you to come forward and share this experience. It's not easy sometimes to admit that we're struggling or that we have struggled in certain areas, and Matt and I both really appreciate it. So
yes, thank you. Welcome.
Thank you.
tell us a bit, Andrea, about your story.
So to talk about it in a nutshell, I was never quite sure if I wanted to have children. I never had that excitement, and that does factor in to the scenario. But when I was about 6 months pregnant, my anxiety went to a next level, and I started to get quite down. It was very hard for me to go into work every day. And I was experiencing something called prepartum depression, which is even less known than postpartum depression.
I hadn't heard of that.
Right. So I was seeing a specialist, a psychiatrist who specialized in that. And it was very, very difficult. And fast forward to the actual delivery, which was the best part of the whole experience. I was induced and had an epidural and didn't feel a thing. And then I had Maggie, born on July 1st. 2015, and I was feeling okay. Looking back, I wasn't so great, but I think because I had just exited this phase of severe depression, I was just feeling such relief. But slowly, I started to spiral downward. I noticed, my negative thoughts were looping again. I was lucky enough to have a night nurse, so that was really helpful in the first few weeks, as I'm sure everybody there knows who has a baby or a puppy. But
Yeah, exactly.
Yes.
Yeah, I wonder if they're night nurses for puppies. Maybe
Yeah,
we
we
should
should look
That's
that
a
up,
really
yeah.
good. Okay, new business idea: night nurse for puppies.
definitely in New York that could work. So yeah, it just started spiraling, and by I would say October of that year, October of 2015, I was not in a good place. I had to come home from a vacation and go into the hospital because they had to get me on medication right away and switch the medication, and they usually can only do that under the supervision of a psychiatrist in a medical facility. And it was just, the whole thing was pretty terrifying.
So you're talking October, and perhaps a red flag, because when I was doing a little search as well, you think of postpartum, and you talked prepartum, and it's amazing. Those are red flags right off the bat, and you were part of that with prepartum. October 2015, you're like 4 months into this, and now you know it's pretty deep right at this point.
Yeah.
And so in terms of, like, you must feel a little bit on an island, and where do I turn? The fact that you had some perhaps counseling beforehand, was that your first instinct? Like, where do I go to try to get some support here, because this is very difficult?
Well, I'm lucky in the sense that my father is a physician. My father-in-law is an OBGYN. My brother-in-law is an OBGYN. So I'm quite spoiled in that scenario. But even so, there are so many women who don't even know that there are psychiatrists who specialize in this. And having said that, they're not necessarily available. I mean, we're talking about 2-3 month waiting lists, and you're talking about pregnancy, let's say, last 9 months, hopefully. And these women, there's one fantastic Dr. Hayton at the Jewish and Dr. Nguyen at the MUHC, and I mean, there's a waiting time of 3 to 4 months to get to both women. And so let's say you see your psychiatrist in, I don't know, you're 5 months pregnant, and then you know, you may not get to see her again before you give birth. So
yeah. You're listening to Life Unrehearsed. I'm Stephanie Erickson here with Matt DelVecchio. In studio, we have with us Andrea Borode, and she's talking about her experience with postpartum depression. Andrea, something that struck me as you were starting to tell your story is you said that when you were about 5 months pregnant, you started having prepartum depression, and you started feeling it. And I just think back to when I was pregnant, and I was scared and nervous about having a baby. It definitely wasn't any kind of a depression or anything like that. But even then, just to say, oh, I feel nervous, what can't I do? I was sometimes like kind of embarrassed to tell people that, because people see you pregnant. Oh my God, this is so amazing. That must have been so hard for you, because here people are expecting you to be over the moon, excited, and inside you're not feeling that way. Was that what it was for you?
for sure, I think that there's a stigma attached to depression in general. I mean, we're at a positive place where anxiety has been cutified, for lack of a better word, through Curb Your Enthusiasm or, you know, Seinfeld. But depression is really, really still stigmatized. It's not cool to have depression. It's not funny. So yeah, when you're pregnant, first of all, there are many women who can't get pregnant, including some of my friends. So already you feel ashamed that you're not overjoyed at being pregnant, because this is not something every woman can partake in. And then, yes, there's this stress to feel and look and act a certain way, as there are with many things having to do with being a woman. But it's extremely stressful, and it's also it's disheartening. And I'm talking as someone who had the most support by the most supportive family and the most supportive husband, and it was very isolating.
And you I think it's a very good point when you mentioned this is a mental health issue. Right? Sometimes the terminology postpartum depression, but depression is mental health, and once you sort of realize that, okay, I'm not alone in this, and there are different areas to help out. There may be reasons to help you get through this, but I'd like to talk a little bit about the contributing factors. You know, okay, we talked about being depressed, but what are some real details that moms are experiencing that you're seeing that are contributing to this?
Okay, well, I think we all know lack of sleep is a form of torture in most countries, and you're experiencing a lack of sleep. If you're an anxious or prone to depressed type person, that will automatically set you off.
Such a good point.
A lack of sleep, and also kind of just going from the night before, you're just hanging out reading a book, to the next day, there's a baby there, it's like a complete, so I think you're in shock, maybe slightly traumatized, not everyone, some people. But yeah, and if you don't even have people to help you out, I mean, I think that night nurses should be covered by healthcare personally, but.
Oh, that would be amazing.
Yes,
and when you were saying that, I'm saying this in tongue in cheek, but I remember when I was leaving the hospital, now my husband, he has 2 older children, so I wasn't as worried. But I mean, they're handing me my daughter, and I'm like, but this is a human. Like, what am I supposed to do? It was very, very scary. But I want to talk a bit more about those contributing factors, Andrea, because I know that it's more than just lack of sleep, although that's obviously a very big one. But first, we're going to go head over to the traffic center.
This is Life Unrehearsed with Matt DelVecchio and Stephanie Erickson. Brought to you by Saveria Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
How about a little yes to bring us into the last segment here? I'm Matt DelVecchio. You're listening to Life Unrehearsed. I'm here with Stephanie Erickson, and we're very pleased to have Andrea Borode, who's talking about postpartum depression. And before traffic, Andrea, we talked about contributing factors, and you mentioned sleep, obviously a huge physical factor. What other are some of the more important contributing factors to postpartum?
There's definitely the predisposition to depression before you have the baby. And I think a large part is also societal pressure, how it's not okay to say, you're not doing well, you're not feeling good. I just want to there's a clarification. There's a difference between the baby blues and postpartum depression. Almost every woman I know has the baby blues, which is just feeling a little low for 3 weeks. But if it's going on longer than that, it's time to get someone else in who's an expert in the field.
Yeah, and I think, I have a friend who, she talked about the same situation as you. She didn't experience the same thing, but where she was trying to get pregnant for a long time, and they went through a lot of treatments, her and her husband, and she's really struggling right now. She has a baby, and she's struggling, and she feels almost embarrassed that she's having a hard time after all this work that she went through, and then now she's having a really hard time.
Yeah, I have a few friends who it took them years to get pregnant, and maybe 2 of them experienced significant depression afterwards. And they also, again, the shame, the guilt, I'm not supposed to be, starting sentences that way in your head. It's very detrimental.
And I think guilt plays a big part. I mean, speaking for myself, I know that one of the things I really struggled with, again, I didn't have postpartum depression, but those moments of not feeling myself, and there was 2 things. One was my body image, and I kept saying to myself, how ridiculous that I'm worried about that my body is not bouncing back when I have this new baby. It's so vain for me to be thinking those things. That was one. And the other thing is that everyone's like, oh, you probably never want to go back to work. And, 2 months into it, I'm like, oh, I'm definitely going back to work. No offense to my children, but I need a different kind of stimulation. It's not enough for me. So are those the kinds of things that you're hearing about?
For sure. And also, it's this incredible thing that not all women are built the same way, that we all have different things that we strive for, that we enjoy. I know some of my friends who never thought they'd give up their job, are so fulfilled by motherhood, and others just need more to fulfill them. It's, one is not better than the other. And the body image thing, well, you could thank social media for that.
Yeah, really.
And Princess Kate.
Yeah.
Didn't help.
Yeah, she's not normal.
This is Life Unrehearsed, and you were just listening to Andrea Borode. Andrea, as the one male voice here in this discussion, and a father of 2 very proud children, I think what I struggled with as a dad, mom's at home, and you're trying to contribute, baby's crying at night, you're going back to the office, and there's the guilt and there's the sleep factor. And what I didn't even realize, but postpartum depression certainly affects men. It's to the tune of 10 to 20% of men as well. And it's
you mean they're diagnosed with postpartum?
Yes.
Oh my God, I didn't even realize that.
Yeah, no, I didn't know that also. But it does make sense if you think about it, because there's, you're trying to do everything, trying to still bring in the paycheck and trying to support your wife and the children. But I think part of it is just communicating, and I know you're involved in certain support groups, mostly for women, but also for men. What, from the male perspective, what can be done?
Well, I think, if women are stigmatized with depression, then for men, I don't even know how many times.
That much worse.
Right. Because a man is it's just not okay for a man to say, I am depressed, I need help. But for sure, I mean, dealing with that lack of sleep as well, dealing with the stress. My husband is a very hands-on father. I don't know how he supported me all the way through that without cracking himself. He's unbelievable. But, that's really something I definitely have not read enough on men who suffer with postpartum. I've read a little bit, but definitely not enough to make any kind of claim one way or another. But I think that would be a really interesting segment.
Yeah, it would be. Actually, that's a really good idea. So tell us, Andrea, because we are running out of time here, and I know that you have a Facebook group going, Moms Supporting Moms. Tell us a little bit about that work you're trying to do.
Right. So it's called Maternal Mental Wellness by Moms for Moms. A girl who had reached out to me, we've now become friends. We started it because we realized, just women just don't feel comfortable talking about this. They don't know where to turn. Some of our members are therapists, psychiatrists who have experienced postpartum. So they're there if you need help through a private message. It's all private. So I really encourage anyone who knows anyone who may be suffering, and you can find me on Facebook and just send me a private message, which people also do, because it's no judgment.
Well, very good, Andrea. Thank you so much. I see a lot of pregnant women walking the streets of Montreal these days. It is the summer season, and there is hope, and there are support groups.
Yeah,
so
absolutely.
Your information was very valuable. Thank you for joining us.
Thanks, Andrea.
Thanks for covering the topic.
Now, and thank you for joining us on Life Unrehearsed. Please join us next week as well. We have an interesting topic. We'll have Alan Thompson from Savaria with us talking about challenging mobility issues and solutions for mobilities. And that's not just for seniors, even young and family members. And we'll also have Lisa Lajoie here with us, who is intuitive about how to use your inner self to create the life you want. Thank you for listening. Please join us every Sunday at 4 o'clock. Now we'll be shortly into the newsroom.